So one station will be done by me and the second station will be by my co-mentor, Dr. Sama Ghaffar. So without wasting time, we are going to start our session. So can anybody volunteer for doing the station?
Yes, ma'am.
Um, please name what is your name?
Ma'am, Shaista.
Shaista, you have already done in the last session, no?
Yes, ma'am. If nobody is willing, then otherwise you can. I can give the
Okay,
chance
so
to
is
you.
there anyone? Because I would encourage you to give
Ma'am,
equal chance
shall I,
to
ma'am?
everyone. Yeah,
Shall I,
who is
ma'am?
going to
No,
do?
Manikam.
Manika. Manikam, you are appearing in the coming exam?
Me, yes, ma'am.
Yeah, good. So Manikam, I'm going to set your 2 minutes time to read the
Yes,
station,
ma'am. Okay, ma'am.
and then you have to perform. Okay,
Mm,
next 10 minutes.
okay,
So here
okay.
your 2 minutes starts now. Now I'm going to share my slide. Can you see the slide, Manikam?
Yes, ma'am, but your practice session, that is only seen, ma'am. There's no task is seen.
Yeah. Can you see the scenario?
Oh, no, ma'am. Scenario is not seen.
Ma'am, this is visible for us.
Is
Ah,
it? Then
Manikam.
you do. Shaista, you say if it is visible, you
Very
please
clear.
do. If
It is
not
coming
visible for
very
me,
clearly. Okay,
then
doctor,
you
I
please
can.
do.
You can
You
wait.
do.
It
Okay.
will be clear.
Who is going
Okay,
to?
Assalamu alaikum,
It
doctor. I
is
am Dr. Samra.
Samra. You want to do? Is it visible to your screen?
Yes, yes, it is visible very nicely.
Okay, so you want to do?
Okay, no problem. I can do.
Okay, okay. So I'll setting your 2 minutes time. So start.
Okay. So I am here as a working as a ST5 antenatal clinic about to see Mrs. Sarah Smith. She is 32 years old who has referred by GP. Your consultant is away from an emergency and the GP letter is attached for you. So the second is not here, ma'am.
Okay. Now can you see?
Yes. Then it is say he is written it, dear doctor, I am Miss reference from Mrs. Sarah Smith. Kindly see Mrs. Sarah Smith, 32 years old, who is pregnant for the first time and she is 10 weeks pregnant. Her BMI is 42. Please review her booking visit. That's the only thing.
Yes. So
So
prepare
what is
yourself. In the next 10 minutes, you have to perform the station.
the thing I have to do? I have to take the history examination, this thing, because I am not getting it. My Miss task is what? Okay,
Can
clinic
you
to
see
see.
the?
Yes, this is the one, information gathering, communication with the patient, safety patient, and applied clinical audit. This is my task.
This is the domain, and in the end, you can see you have 10 minutes to.
Okay. I get it now. I take the relevant information, address the patient concern, formulate the management plan. Okay. Okay. Madam, Dr. Samya, I think, sorry, can you please, okay, thank you. This is why I'm asking.
Are you ready to start the station?
Okay, I'm ready.
Okay, your time start now. Start your station.
Okay. Okay. Hello. My name is Dr. Sorry, I'm Dr. Samra. I have read the question and I am ready for discussion. Okay, so I will read it. So the thing is that this is hello. I'm Dr.
Samra, hold on. Samra, can you see which task is all about? Can you see it?
The stimulated task patient is a lay with a lay examiner, and you will be assisted on the information gathering, communication, patient safety, and applied clinical knowledge. So you are ST5 working in antenatal clinic. You are see
Okay,
this
hold on.
patient.
So what do you understand by this patient simulated task? This is a
So
structured
mine,
discussion or it is a role play station?
it is a layman examiner. It's a stimulated, structured discussion.
This is a
Hello?
simulated patient task. This is not a structured discussion.
Yes, yes,
Lay examiner
sorry.
is sitting. Lay examiner is sitting in this particular scenario to assess how you are talking, how you are communicating with the role player. Okay.
Patient. Okay. So who will
So
be my patient?
sorry.
Sorry, you will be my patient? I will
Yeah,
take from you.
I will play the role play. Yes.
Okay, that's what I'm asking now. So, okay, you will be my role player. Okay.
Okay. So now I'm starting your 10 minutes time and you have to start. Okay. So start.
Okay. Okay. Hello, I'm Dr. Samra, one of the Dr. Antenatal Clinic today. Can I confirm your name and age, please?
Yeah, I'm Sarah Smith. I'm 32.
Can I call you Sarah?
Yeah, fine.
Okay, Sarah, you are here by your GP. He has been referred to you because this is your first visit of antenatal care, and he is concerned about because your weight is BMI is 42. Am I right?
What, doctor? What you are talking about? My
I'm
GP
saying
refer you because of my weight?
you have been referred by your GP for antenatal care. You are 10 weeks pregnant. Am I right?
Yeah, doctor, this is right. I'm 10 weeks pregnant. I'm going good. There's no problem. I'm not, and it's surprising for me why the GP referred me here.
No, no, no. For the antenatal care, he refer you.
Okay.
Okay, if you don't mind, can I ask you a couple of questions and then we'll make the management plan. And in the end of our discussion, I will give you the patient information leaflets, web addresses, and the next appointment, I will make a consultant. It's okay for you?
Yeah, it's fine.
Okay, please can you tell me more about your antenatal? This is your first visit?
Yes.
Okay, you have any problem like nausea, vomiting, any PV, bleeding, leaking?
No, I don't have any issue. My pregnancy is going smooth.
Smoothly. Good. Nice to hear it. Okay, this is your first pregnancy?
Yes.
Okay. So with the before you don't have any abortion, termination of pregnancy? You never been get pregnant? Only this one first time?
Yes.
Okay. Nice to hear it. Can you tell me that your last menstrual period is going with this 10-week pregnant?
Yeah.
Okay. Okay. Do you use any contraception before this before getting pregnant?
No.
Okay. Your pap smear is normal and up to date.
Yes.
Sorry to ask you one question. Do you have any sex sharing disease?
No.
Okay. Do you have any medical problem which you are taking continuous medication and following up to your GP?
No, I'm healthy otherwise. There's no problem.
Good. Nice to hear it. Are you allergic of any medication?
No.
Do you take any? You have any surgery in your tummy and down below?
No.
Okay. Whom you live
Yeah, with my partner.
is cooperative.
Yes.
What you do for living? What's your job?
Yeah, I'm a homemaker.
Okay. You're okay. Do you smoke, take recreational drugs and alcohol?
Not at all. No.
Okay. Do you have any family history of note
No.
in the last? Okay, in the last 4 weeks, you are getting any depression, any not interested for any things?
No.
Okay, thank you for sharing all this information with me. Then I will examine you in presence of chaperone. Only just I will do the per abdomen examination, and then I will run for you some because you are first time coming to the antenatal. We will run for you the antenatal investigation for you.
Doctor,
And
it's
after this,
already
our
been done. Yeah, it's
huh?
already been done. And it's already been done, and the GP told me that they are all normal.
Okay, nice to hear it. Okay, so all your investigations are normal and your examination is normal. So we'll going to make the management plan for you. See, Sarah, because of your and all the antenatal investigation which we done is normal for you. But the only concern for our from our side is that your weight is little on the higher side. For this, most of the people, they will get it normally. There is no problem for that one. But in that, now you are pregnant, you have to, we will going to make a plan for you for your antenatal
Uh,
visit.
Doctor, again and again, you are trying to say that I am obese, I am fat. That's why the GP referred me here. You want to say like this?
No, because the GP is not the thing. The thing is that because every antenatal cases has to be referred to the clinic, okay, to the hospital first visit. But some, and now from your side, it is little higher. I'm not telling you that you are so much obese and this thing, but it is higher side. I'm sorry to say this thing. So for this thing, we have to make a management plan because it's going to affect you on your pregnancy and on your baby. That's the thing
Okay,
I'm trying to tell you. So for
okay,
yourself, mostly the pregnancy will go smoothly and you have no complication. But there is a small, slight complication which you can have it because of the increased weight. Because you have to have some visit when you're coming to the hospital. You need a regular checkup for yourself or for your baby. For from the early pregnancy, okay, we all the antenatal investigation which you done are normal. So later on, we are going to make for you this dating scan, and after dating scan at that 20 week, we are going to make for you the anatomical scan for your baby. With this scan, we have to check for your baby head to toe, baby, this we call is scan. And for yourself, we will do for you the booking visit. We will do for you the one test which we call a diabetic test. If it is normal, we are going to repeat it at 24 to 28 week again. And from 24 week, we will start for you the sorry, before this 24 week, we will assist for you the some DVT which we call it clots in the legs. For every patient we are assisting, not for you only. We'll start for you vitamin D, and we will start for you the aspirin as a profile exit. Okay. And then after this one 20 week anatomical scan, then we will start for you 24 to 28 week. Will measure your baby height, but sometime it is not possible because some women it is not possible. So we will do for you the ultrasound measurement, and we will plot a graph, serial ultrasound, which we call it growth of the baby. And with this growth of the baby, we'll check for you how your baby growth is going on. And for you have to visit up to 28 week every 3 to 4 weekly. Then your 32, from 32 week, you will start to come 2 weekly. And at that time, this growth scanning we are going to check for you, and we will check this any abnormality for the baby. But I hope it will be not. And then what we have to do at the because you need to be, when you are following up to the clinic at 4 weekly, we have to check for you the blood pressure because you have a risk of getting hypertension. And for this we have to check for the urine and your blood pressure whenever you are coming to the clinic. And if the blood pressure is controlled, you don't need to be started any medications according to that blood pressure what you are going to have it. So after that 136, then we will continue your if it is going, everything is fine. But you have before that, we have to tell you that sometimes it can happen that before your due date, it can happen that the patient can go before a date in labor. So you have to know the signs that you will start to have a contraction. Maybe there is some leaking, bleeding, mild spotting. So you have to come quickly to contact to the hospital. These are the signs which we call it preterm labor. This is very important. And the another thing which can happen for you also, because the increased little weight, it can happen the complication for you and the pregnancy. One of the, can I tell you if you like to hear it?
yes, go ahead.
Okay, for you it can happen that okay, if can you happen, and then the weight, because of this thing, because of little higher side of the weight, we can have it after baby can have a congenital abnormalities. Mostly it is having a heart abnormalities and cleft lip, cleft palate, And this on the back of the baby, there is a one swelling which we call it this swelling which is this I forget this one because this is a new topic for me. Anyway, for after that one, then this sacrococcygeal swelling, I don't know whatever it is called. Then what we have it, and this baby for the baby. And for the mother, it can happen that it after because mostly it will be prolonged labor. Mother can have a prolonged labor. She has an increased risk of having operative vaginal deliveries, which we use an instrument. This we call operative vaginal. Increased risk of the cesarean section and PPH. So these are the risks can happen. Okay, and after that, when you will come maybe 36 week, you have up to this one when we are doing the antenatal care, you have to need a for your BP measurement,
Time of
cuff will be a little bigger. Okay, I did not reach 36 week. Thank you. Thank you for
Okay, thank you very much to deliver a very nice lecture. Okay, so Samra, how do you
yes,
reflect on your performance?
because I will now complete my mistakes back because I did not ask to the patient, am I clear for you? This I did not ask her. Okay, one thing, this thing. And I
Okay.
reach up to 36 week, but I don't know because for me it is first time I get this topic. So I'm in the middle. I
Hmm.
think I done myself better, little better, but the thing is that I did not able to complete the things. That's the thing.
Okay. So Samra, are you appearing in the upcoming exam or you're just
Inshallah,
practicing?
inshallah, 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 inshallah,
Okay. So in the May exam, you're appearing?
inshallah.
Have you booked the seat?
Yes, my dear. Yes, doctor.
Okay. So Samra, the important thing is this, that once you enter, as we already discussed in the previous session as well, it's very important that the situation awareness is very important. It's very
Yes,
important
yes.
to check this is a simulated patient task, this is a colleague oriented task, this is a structured discussion. It's very important. In a structured discussion, it is clearly written this is a colleague oriented task. Okay.
Yes, I did not notice. You're right.
Or in the tested domain, they have mentioned communication with the patient will not be there because there will be no patient, they're only an examiner. Okay, so once it is clearly written there is a simulated patient task and you have to be tested on these domains, and the task is written below. You have 10 minutes to take the relevant information, address the patient concerns, and formulate a management plan. Okay, so this is very important that you start. So you start very haphazard. You start with a wrong introduction. So again, I set your time and just realize you that where you are and who you are. Okay. Then you start again. Okay. I just find out your points that needs to be improved. Okay. Okay. You made mistake here. So that's why you improve yourself. Okay. And don't repeat that mistake in the next session. Okay. So here you easily see that you are ST5 and you meet this patient who has referred by a GP. And again, this line is very important. Your consultant is away for emergency and the GP letter is attached. It means you have to say this thing that I can see that you are here to see my consultant, but consultant is away. So it is okay. I go ahead with the consultation. Okay, this thing is written over here for a reason. This is not written as a usual case. Okay, so everything is written in the scenario for a certain reason, and they just want to assess that how you read the scenario and how you act. Okay, so this thing is also missing. Once I set again your 10 minutes time to start, then again you just say that okay, I can see that you referred by a GP because your weight is high. At the same time, the role play picked this thing, and you offended the role play, and you by realizing that he or she is fat. She's fat, and that's why uh, the GP referred her. All the information is being given to you. It is giving for you. Don't assume that the patient know that why is being referred here. Okay, maybe the patient doesn't know, the GP referred you to give you the information why the GP is referring you. This is because of you. Don't assume that patient already know. You can ask that, do you have any idea why the GP referred you here? The patient told you that no, I don't have any idea. I'm okay. I'm fine. I'm healthy. I'm enjoying my pregnancy. Everything is going good. I don't have any idea why the GP referred you. So it means that the patient doesn't know, because she is though she is obese and she doesn't have any health issues so far, so she realizing that everything is okay for her. She doesn't know that what could be the implication of this high BMI for her pregnancy. Okay, so at this point of time, you don't raise this issue. You just say, okay, you are here. We will discuss how can we plan your pregnancy to have a successful pregnancy outcome. So is it okay if I ask a couple of questions to know more about your pregnancy, and then we will discuss how can we plan your pregnancy care. Okay, and once you finish your information gathering, then you say, always say your weight to height ratio. Don't say your weight, your weight, your weight. Two, three times in between the station, you just offend the patient again and again that because of weight, and in between the patient told you that you are trying to say that I am obese, I am fat. At the same time, you just apologize the patient that no. So again, the patient, you are offending the patient, then the patient also offending you, and the
Yes,
station just go at the same time, the station just go out of your hand. Okay,
yes, you're
so
right.
but I want to make you go ahead with the station. So your applied clinical knowledge is okay, but your communication needs to be improved. Okay, you just say that okay, now after information gathering, you can say that okay, your GP has raised some concerns because your weight to height ratio, that is BMI, is slightly on the higher side. Normally it is up to 25, and when it is goes beyond 25, so it has sort of some sort of implication for the baby and the mother during the pregnancy. So we are here to help you out to have a successful pregnancy outcome. Okay, so that's how your patient will realize why this is important and what are the implications. And then you have to tell each and everything, what are the maternal risks, what are the fetal risks, what are the risks in the labor, and how can we overcome all these things. Okay, so don't offend your patient and don't get offended by her. So this is the main thing. So communication needs to be improved, Samra. Okay, so domain-wise information gathering, history of presenting illness and pregnancy detail. You have to inquire about, okay, after introduction and after the consultant is not here, after addressing all this issue, you can see, you can inquire about from the patient that do you have any idea if the patient doesn't know. So, okay, we are here to help you out to make a suitable management plan for your pregnancy. But before that, is it okay if I ask a couple of questions, and then you start your information gathering? May always open with the open-ended question. May I know about your pregnancy, which is a planned, unplanned, and are you taking, you missed most important points. The static point you already missed. Folic acid. If the patient is taking folic acid, you can inquire whether this is a normal dose, or do you know about the dose? Because in obesity, we have to give a high dose of folic acid, 5 milligram. Okay, and as and you just cover all the history points: medical, surgical, smear, and the family history, and the blood group. You inquired about the blood group of the patient, or you missed?
No, no, I did not inquire.
So blood flow preservation for the blood transfusion, smoking, alcohol, recreational drugs, okay, social history, support you ask. So all these things are, so you inquire about the allergy as well. But very important, in between you inquire about, have you ever been treated for sexually transmitted disease like this, no? So why this is important here? There's no need to inquire, and you directly inquire. Okay, if you inquire, so you directly inquire before signposting. Okay, so
Okay,
there's no need to inquire about the sexually transmitted disease.
okay, okay,
Okay, um, then communication with the patient, communication is very weak. Almost, if we gave marks, so this is not a past domain. Sorry, this is not a past domain. And you can easily pick what are the mistakes you have already made in this station. So don't make in next time. Okay, so your introduction, your identity check, make a report. have to assess the patient concerns, set agenda. Then you have to be very non-judgmental approach and not offend the patient. Explain the implication of high BMI in terms of maternal fetal effect and effect on the labor. Organize explanation in a logical sequence, and then you have to provide information in chunks, and in between you check the understanding. That's why at the end of the session I just told you that okay, thank you very much for giving a beautiful lecture, because you haven't asked me throughout the station that are you with me, is there anything you want to repeat. Okay, so it's very important to involve your patient. Okay, and once
Yes,
you are
I
giving the,
remember.
yeah, a very important thing, otherwise it will be like you deliver a lecture and you try to deliver all the knowledge which you have in your mind, just you are throwing on the road their face. Okay, so and if you are giving any sort of maternal fetal effects, very important that because fetal effect are, there may be a risk of birth defect, there may be a risk of miscarriage, there may be a risk of big baby, and during the labor there's a risk that the baby shoulder may get stuck and there will be a difficult delivery, and in some cases there is a risk of death of the baby. I don't mean to scare you, but these are the important information that you need to be aware of. So it's very important, in a very gentle way you have to explain all the risks. Okay, and then MDT approach is very important. Your care would be by a team of a specialist doctor, including my consultant, the baby doctor, the imaging doctor, because we might need to see the growth of the baby, and by doing a serial scan, because it is very difficult to assess the baby's growth by doing examination. And why you are doing P examination? Why? At 10 weeks, why you are offering P examination once you told that I'm going to do a P examination? No need. No need to do a P examination. Okay. And one thing I also noted that you told to the patient that that you are here because every case has to be sent to the hospital for the consultant review. Why?
Because I am talking
No
about,
need.
look, her overweight. He has to refer
Yeah,
her.
yeah, because you made a mistake, you you offend the patient, and patient going to offend you. So in order to
Yes, yes,
compensate, you are just doing mistake and mistake and mistake.
yes,
Okay,
you are right.
so yeah, so this is not the way to handle such kind of situation. And don't say wrong information to the patient, because in UK, all these initial visits being done by the midwife. They have a designated midwife clinics, and they are doing anything. And if the midwife think that there's anything abnormal, and this thing needs to be assessed by the consultant, so only in that way they send the patient to the hospital. Otherwise, there's no need. If only one visit is being needed, so they can send at around in the third trimester for the assessment of the, if this is a first time pregnancy, for the assessment of the mode of delivery. Otherwise, all the visits being done by the midwife. So don't give the false information to the patient. Okay. Um Always use lay language, avoid jargons, provide information leaflet is very important. Whatever you are saying, it has to be supported by the information leaflet, written information leaflet, and you have to provide a clear management plan to the patient. Like what is being done in the antenatal period, what is being done in the intrapartum, and what will be in a postpartum period. Communication with the colleague, just saying that your care would be by a team of a specialist doctor, this. Okay, so that's how this domain will be passed by saying just one line. Okay. So this is very important. Patient safety and applied clinical knowledge, and you apply clinical knowledge, you miss very important points. It's very important that provide. Okay, this patient told you that my booking investigation and all the scan has been done, and it's all normal because she's 10 weeks pregnant. So why you are again offering her dating scan? No need for date. It's mean it shows that you are not listening to the patient. You are offering a dating scan because it's in your mind. You have a set template that I offer this. So you are not listening to the patient. You just delivering your own set template to the patient. So don't do this again. see what's the patient's telling you. So a patient tell you that already taking scan is done, so you can say that we will be offering you screening for the Down syndrome, and further on we will do like birth defect scan and how the baby is growing. Later on it will be done. Okay, so you rightly emphasize on the regular follow-up and folic acid 5 milligram till first trimester. Then it's very important that we also give, this is a obese patient, so we also give vitamin D, and aspirin needs to be started, which is in a dose of 150 milligram. Uh, because because the women who are having high BMI, high those women whose weight to height ratio, they are on the higher side, they are increased risk of developing high blood pressure and the leakage of the protein in the urine, baby sugar. They also have an increased risk of clot formation. So because of that, to reduce the risk of high blood pressure, we can start aspirin from 12 weeks onward, and at every visit, your risk for the development of the clots will be assessed, and accordingly we will deal the situation. Okay, Samra. So you have to be very open and honest about the condition effect, about the condition of this a high weight to hydration on the baby and the fetus and the possible complication. So in the antenatal period, as this is a high risk pregnancy, so team of specialist doctor involved this, and during this pregnancy, you can say that we can also refer you to a dietitian who can provide you a balanced diet plan to avoid so that will be help you to further uh, gain in your weight. Or just you can say that I will refer you to a dietitian who will provide you a balanced diet plan throughout the pregnancy. Then anesthetic review is very important. Hmm. So ultrasound, anomaly, growth scan, GTM screening, all the risk needs to be explained in a very sensitive way. During the labor, there's a possibility that there's a failure to progress of labor and the risk of emergency C-section is being there. There may be a difficulty in the monitoring of the fetal heart rate, so you may need a continuous electronic fetal monitoring. And our aim is to have a vaginal delivery in a consultant-led unit, and there's a risk that you may bleed you may bleed more after the delivery of the baby. For that, we will pass a plastic tube into your vein to give you certain medications to arrest the bleeding. Okay, so that is active management, third stage of labor. Postpartum care, again, after the delivery, there may be a risk of clot formation, there may be a risk of heavy bleeding, there may be a risk of infection, and some women may have some sort of depression. So we will cater all of these, and we also provide support in your breastfeeding. And to reduce the clot formation, we will offer you blood thinning agent for at least 10 days, and according to the risk, if there are any other risk factors, so it may be longer. So according to the risk scoring which you have in your guideline, so similarly the days can be increased. Otherwise for the 10 days is a usual. Okay, so provide support group and provide information leaflets. Sometimes these are very important points, so these should not be missed. Folic acid 5 milligram, aspirin 150 milligram, vitamin D, risk assessment, all the maternal fetal risk. Okay, so these are very important, these are static points that should not be missed. Though these station may take a longer time, but by doing practice more and more, so these are one line, you can say in one line. Okay, and don't miss the most important points, and check the
Okay.
patient understanding. Okay.
Yes. Yes. This is the problem I done. You're
Yeah,
right.
Samra,
Thank you.
you need more and more practice, and very important, as I said in a previous session as well, situation awareness is very important. Let's see, because you were stuck at the beginning. Okay, I'm ready for my structured discussion. If you imagine that if you did this thing in your final exam, so what happened? So it's very
Yes, you're right.
important. Try to read, try to utilize these 2 minutes very smartly. And as you are reading in front of me, so maybe if it is a virtual exam, online exam, if you try to read very loudly in front of the examiner, it not look good. Okay, try to read in your own in your own mind. Okay, just look and just read. Try to do practice with this as well. Don't read loudly in front of the examiner. Okay. Okay, Samra?
Okay, okay. Thank you.
Okay, thank you. So, Dr. Saima, are you there now?
Yes, I am here.
Dr. Saima, so next station will be by you now. So I'm going to
Yes.
uh, stop sharing, and you can start your slideshow. Okay.
Hello, I'm Ifat, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yes, doctor. I'm Amelia Smith. I'm 28 years old.
Okay, how may I address you?
You can call me Amelia.
Amelia, I gather from your GP letter that you are in the first, in your early pregnancy, and you have done with the screening reports, and you are here to discuss about the results. Am I right?
Yes, doctor.
Mhm. So, I will be definitely discussing with you the results. Is it okay if I ask few questions to know more about you so that we can come to a mutually acceptable plan?
Yes, doctor. No problem.
Yeah. Melia, is it your first pregnancy?
Yes, doctor.
How is the pregnancy so far?
So far, everything is okay. And
Mm-hmm.
I'm taking folic acid. I don't have any
Mm-hmm.
problems.
Okay. Are you done with your booking a blood test?
Yes,
Are,
I'm here to discuss the reports of
okay.
booking
Any
blood.
morning sickness, bleeding down below, any tummy pain?
No, doctor.
Okay. So,
No, doctor.
mhm. So, and do you have are you when was your last menstrual period?
It was 12 weeks back.
And was your periods regular?
Yes, doctor.
Hmm. Are you updated with your cervical screening?
Yes, doctor. It is normal.
Mhm. And do you have any allergies?
No, doctor.
Are you generally fit and well?
Yes, doctor.
Any surgery on the tummy or down below?
No, doctor.
Few questions regarding personal habits. Do you smoke?
No, doctor.
Drink alcohol?
No.
Pardon me, any recreational drug?
No, doctor.
What is your blood group?
It is O negative.
Any reservations for blood transfusion?
No, doctor.
What is the partner's blood group?
He is B positive.
Okay. So, what is your weight to height ratio?
Doctor, it is normal. I think 22.
Mm-hmm. So, whom do you live with?
I live with my partner John.
So, what do you do for living?
Doctor, I am a homemaker.
Okay. Do you feel depressed or low mood in last couple of weeks?
No, doctor, I am very happy because I conceived after a long period of time.
Congratulations on your pregnancy. And
Thank
do
you.
you want to add something?
No, doctor, I am just worried about my screening reports.
Yeah, surely I am coming to that, Amelia. And I can see that you are here alone. Do you want someone to be with you?
No, doctor, I came alone today. My
Mm-hmm.
partner was at work.
If you want, I can ask my nurse to sit with you because I am afraid I have some concerning news to discuss with you.
No, doctor, you can discuss.
Mm-hmm. So, Amelia, I have confirmed the name, your age, and NHS number. Reports belongs to you, and it says that the your screening result came out to be high risk for the Down syndrome.
What, doctor, you mean I'm having Down, my baby is going to have Down syndrome?
Amelia, what is this? And that this is a screening test, which means that it the results comes on like high risk or low risk. When it is 1 into 150, it means high risk. Are you with me? It is
Yes, doctor, but
not
I
a
can't understand what you are saying.
Yeah. So here I would like to tell you that the result is 1 is 149. It means that one baby has a chance to be having Down syndrome in 149 babies. So there is a chance that 148 babies it might not be. Okay? It's not a
Okay,
diagnostic test.
doctor.
Hmm. So here
So,
I
doctor,
would like to,
how I become,
yeah, Amelia, what you are asking?
how I will come to know my baby is down?
Yeah,
I'm asking
definitely.
how I will come to know my baby is down or not.
Yeah, exactly. I'm telling you, it's a don't worry, it's a team of doctors care, and my consultant, a specialist midwife, a fetal medicine specialist, GP, they all will be taking care of you. Now, next are the two options. Either we can go for another screening test, which tells more appropriately whether the baby has Down syndrome or not, or we can go directly for diagnostic test. Diagnostic tests are the needle testing, which I want to show that it's done under the ultrasound guidance, and tissue of the baby is taken from the afterbirth and from or around the water of the baby. But the risk is that it can lead to miscarriage in 1 in 200 women. Am I clear so far, Amelia?
Yes, doctor, you are saying that my baby can miscarry with this needle test? Oh my God,
Uh,
doctor, I conceived in a third cycle of IVF, and I've been
I can
trying for the
understand.
pregnancy so long. So
I can
how can I go
understand
for this test?
anxiety. I can put you in touch with the counselor as well. But Amelia, it is only 1 in 200. The another option we can opt that we can go for another screening test, which we call it as cell-free fetal DNA, in which the blood sample is taken from the mother, and we check for the baby is having the Down syndrome or not. It is about 99 out of 100% that the baby will be having or not. Am I making myself clear, Amelia?
Yes, doctor.
So, what is your preference?
Doctor, I'm very confused. I'm not able to make decision right away.
Mm-hmm. So, it's no worries. Amelia, I will give you patient information leaflets, and I will put you in touch with the consultant as well. And I will giving you connect with the sport groups, and I am writing back to your GP. You can go home. You can discuss with your partner. Whatever the decision you made, we are right here to help you in that situation. Okay?
Yes, doctor.
Do you have any questions?
So, No, doctor.
Thank you for your time, Amelia.
I'm quite upset. I'm quite upset after this news.
I'm so sorry that, but I will put you in touch with the counselor as well, and you can take the professional help as well. It will be really helpful. But I want to be like honest and open to you. Okay. Do you want
Okay.
me to tell me more
Thank
about
you.
Down syndrome? Or you know it.
Uh, no, doctor. I want to go.
Okay. Okay. Thank you.
Okay, your time ended. Thank you.
Yeah.
Okay.
Thank you.
So, thank so overall, your performance was good. So, Ifat, what do you think about your performance?
Yeah. Like I have to explain
Okay, I
about
give
the
you.
Down syndrome as well. Yeah.
Yes, right. Yes. You should check her ideas, what she already
Yeah.
knowing about Down syndrome. Okay.
Yeah. Exactly.
So, let's give you feedback.
Hello.
Hello.
Yeah.
My slide is not moving. Okay.
Ma'am,
So,
you are
I'm
not
going to
audible.
give your feedback. Information.
Mm-hmm.
I'm not audible. Hello.
Yes,
Can
you
you
are.
hear?
You are audible. Yes. Yes. Now can hear.
Okay. I think there is some network issue. That's why
Mm-hmm.
you're not able to hear me. Okay. So, I'm coming to your feedback. Some points were missing in the history. Otherwise, it was okay. But you missed some important points in the history, and you asked about some irrelevant information in the history. It was important to
Mm-hmm.
ask either it is planned pregnancy or not. Okay,
Yeah.
and either it is a spontaneous conception or it is IVF pregnancy, because when the
Mm-hmm.
role player told you later, then the role player was panicked when she uh,
Mm-hmm.
when you told her that you need a needle test for the confirmation, because this patient is very sensitive about her baby,
Mm-hmm.
and
Yes.
this situation is different from the case where the patient has already two or three babies, and
Mm-hmm.
here the situation will be different.
Yeah.
Okay.
Yes.
Yes, and in the station here, age was not written, but her
Yeah.
date of birth was mentioned. So instead of here, there was mentioned her date of birth in the letter. Age was not
Uh,
mentioned here. So you said that
I could
can
not
I
hear.
confirm your age? Instead of, can you hear?
Now I can hear. My your voice is cutting in between.
Okay. Yes, I'm sorry. I think there is some network issue. That's why it's happening. Can you hear now?
Yes. Yes.
Okay, okay. So instead of asking, can I confirm your age? It was better that you ask her, can I confirm your date of birth? Because in the letter there was no mention of age, but her date
Mm-hmm.
of birth was mentioned. Am I clear,
Okay.
Ifat?
Yes, ma'am.
Okay. And yes, and then it was already written that she was pregnant for the first time, and you asked it again.
Mm-hmm.
Okay.
Okay.
Family history was important. You can ask, is there any family history of Down syndrome or any abnormal babies, right?
Mm-hmm. Yes.
Okay. And you asked about reservations of blood transfusion. This can be omitted in this history because we are not going to do any blood transfusion or any major operation, right?
Mm-hmm.
because
Yeah.
we have to take relevant history. Otherwise, our session will become so long, and we will not able to give time to the management part.
Mm-hmm.
Information gathering is one domain. That's why I am telling in detail what things can be omitted and what things need to be emphasized more in the information gathering. Okay,
Yeah.
but
Okay.
okay. You also about the partner Pralco, but you did not offer any NTD in case she go for the needle test. Okay,
Mm-hmm. Yeah.
right?
Yeah.
Okay. So when you started conversation, your BBN was very good. You gave her warning shots and you offered her that did she want to join someone, or you can ask the nurse to sit with her because there is a difficult news for her. BBN part, I am satisfied. You performed this part very well. Okay. So then what? How you will explain the results? You will explain that. Do you have an idea what is this combined test? This in this test we have done measured thickness of fluid behind the neck of the baby by doing an ultrasound, and
Mm-hmm.
we have measured two proteins in the blood, which are beta acidity and PAP-A, and
Mm-hmm.
also considering your age, we have combined the result of all them, and then we have just calculated our risk, and we have a
Okay.
cutoff, and if the risk is more than cutoff, it is high risk. If it is less than cutoff, it is low risk, and
Mm-hmm.
this cutoff is 1 to 150. So in your
Yeah.
case, the risk is 1 into 149. It means it means that if we do the similar test in 149 women, means if the
Mm-hmm.
149 women has same result like you, then 148 babies will be absolutely okay, and just one
Mm-hmm.
baby will be having Down syndrome. Okay, when you will explain in this way, the patient
Mm-hmm.
will not be upset because she will understand it clearly that her risk of having Down syndrome is not very high. Am
Mm-hmm.
I clear, Amelia?
Yes.
Yes. Okay. So this task is very important in the communication point of view. Either you are able to explain her result so that the patient can
Mm-hmm.
understand her risk. Okay.
Okay.
Then the important points you missed, you did not check her ideas or her knowledge about Down syndrome.
Yeah.
Okay. And
Yeah.
check her idea. Does she know what is Down syndrome? And then give her the further information. These are the what why it happens. There is one extra
Mm-hmm.
chromosome. That's why such babies
Yeah.
can have problem related to their IQ, their physical, mental
Mm-hmm.
health, and most of the babies will need some assistance. Uh, and whereas some babies do very good and they can even go to the school of normal children because Down syndrome has a wide range of variability. But we can't judge which babies will behave better after birth or which baby will not behave after birth. Am I clear?
Mm-hmm.
And
Yeah.
then you will say that I will offer you a patient consultation leaflet about Down syndrome. Here all the information is written about such babies. Okay, am I clear, Ifat?
Yes. Yes.
Okay. And you offered her confirmatory test. Okay. So instead of saying directly to the patient, it was a better way if you say in this way. I'm telling.
Mm-hmm.
Uh, Amelia, some women after such high risk screening test want to go for confirmatory test in the form of needle test in which we put a needle inside the tummy and we take a small part of after birth, which we call as chorionic villus sampling, and this test is done at the fetal maternal unit. And
Mm-hmm.
because such women think that in case their baby will be down, they will end this pregnancy. So may I know
Mm-hmm.
what are your thoughts?
Mm-hmm.
Okay. So instead of saying directly to the patient that I am offering you, these are the options, fetal
Mm-hmm.
DNA, just uh, give the reference of other women and check her
Mm-hmm.
thoughts.
Mm-hmm.
Are you understanding Ifat, what I'm saying?
Yes, yes,
Okay.
completely.
In this way, patient will not get upset. Yes, that you are forcing her to undergo this needle test, and there's also a risk of miscarriage 1 into 200 because this patient has conceived after third cycle of IVF. She is not willing even to undertake
Mm-hmm.
this risk. Okay, and at the same time, if patient says that I don't want to undergo this test, uh, then you will say whatever you will decide. We will respect your wishes. And Amelia,
Mm-hmm.
there is another test which will be done in your blood, and it will detect the baby cell inside your blood. But unfortunately, this test, which we call as cell-free DNA, it is also a screening test, and it will not tell for sure either your baby is having down or not. And this test is also very expensive, and it is not available in the NHS.
Mm-hmm.
And so you will give information by information about self-free DNA. Okay,
Okay.
and then you will give her some time to think. So, Amelia, what are your thoughts? What do you want to do? Then the patient said that, doctor, I'm very confused. I can't decide right now. Then you will say that, Amelia, you won't need to decide right now. Please take your time, and I'm providing you patient information leaflet, and whatever you will decide, we will be going with you. And in this way, we will also offer another meeting with consultant because
Mm-hmm.
this is high risk case. Right. Am I clear, Ifat? Do you have any
Yeah,
questions?
thank you so much. Yeah, thank you so much for
So, communication point of wise, your tone was good. You gave information in chunks in between. You checked her understanding. Your breaking bad news was very good. Just explanation of the condition. If you tell in the way that I told you, uh, you
Mm-hmm.
can score very good marks in this station. And this station is asked very commonly in the exam.
Mm-hmm.
And just focus on the history taking. Just ask relevant history, omit irrelevant history. In this way, you will be able to complete your station within time.
Okay.
Okay. Thank you.
And can you share the slides, ma'am, which you
Slides,
have?
I don't know what happened, why it's not moving forward. There's some
Because you
problem.
has increased the size, you can go to the original size, then it will be able to move to the next.
I don't know what actually happened.
Or you can select from the left side where the slides are given,
I'm selecting there is information gathering and
but it is not appearing.
okay, if you want, I can share the this PDF file in the group.
Yeah, sure, ma'am. Thank you.
Okay, okay, I
Yeah.
will share. Here all the points are written, but most of the points are the same which I told you.
Okay.
Okay, I will share it. Okay,
Okay. Thank you.
thank you.
Thank you.
Thank you so much, ma'am.
Okay, so
Thank you.
thank you all of you to attend the session. And
Thank you, ma'am.
then, yeah, this way we try to help you out in pointing out your mistakes. So if you did mistake here, so hopefully you will not make in your final exam. And that's the main aim of doing session here. Okay, so if you have any queries, so you can post in our Telegram group. So we will try to answer you then and there. And we try to make more practice session. So it will help you for the upcoming exam candidate to boost up. Okay.
Yeah. Thank you so much, ma'am, for your efforts.
So thank you for time and keep tune up to see when we are going to have another session. Okay.
Okay.
Thank you.
Thank you. Thank you, ma'am.
Ifat, can you see the slide now?
Yes, I can see, but the font size is very small. I can see, but yes, ma'am. The next one.
Not opening. Okay, I will share it soon after the session ends. I will share in the groups. Okay. Thank you.
Okay, okay, okay. Thank you.
Thank you. I think it is opening. If you want to take a screenshot, you can take.
Yes, yes, it's opening now.
Uh, Information gathering,
Yes,
communication with colleagues,
yes,
communication with patients and relatives, applied clinical knowledge,
yeah.
and patient safety.
Okay,
Okay. Okay. Thank you. I'm ending the session. Thanks all for joining.
okay. Thank you.